and there are some public health concerns that tend to occur annually when we are in the rainy season.
Yeah.
But more importantly, we have been alerted about the cholera outbreak in our neighboring state, Lagos State, where there has been five mortalities and 60 admitted. So it is important due to the lack of border between Ogun State and Lagos State. When you look at Ota, you look at Muwe Bafo, you look at Ifo, there is, there is no clear border. People move across the border.
Yes.
So we wanted to make sure that we bring awareness state to look out for their neighbors, look out for themselves, their children, their wards, so that if there are any incidents of such cases, they can
Yes.
report it. The first thing is that it's a serious, cholera in itself is a serious bacterial infection. And the way it presents itself is, very bad diarrhea, frequenting the toilet, and they call the stool rice-like stool, and it's runny, it's white, it's frequent, it leaves you weak and dehydrated. This could be associated with vomiting. So if you are experiencing such, or anyone of your family members or friends or colleagues at work are experiencing such, you need to present yourself at the nearest public health facility, which is the government-owned facility. Please try and avoid going to private hospitals. But if a private hospital is what you have nearest to you, that is fine. But ensure that you notify our disease notification officers. That's for the private practitioners, to ensure that all the management that we can put in place on time can be put in place. Because if left untreated, cholera can kill, but it is not a disease that should kill. It is easily treatable by oral rehydration and some antibiotics, particularly in children, because children are small in size, and over 70% of our body mass is made of water. When that water gets depleted, children are the first to succumb, and unfortunately, it could lead to their death.
Okay. Ogun State has this reputation of being first in terms of taking care of its citizens health-wise and having this kind of intervention. Remember the COVID-19 when it first broke out in Nigeria. The state took some steps easily to make sure that there is a limit to its infection level in the state. How prepared is the Ministry of Health in combating and making sure that there is a level at which this
We are very prepared, but in managing and controlling this, it requires we, the health sector, and the citizens. It's a collaboration between the citizens and us. As a health sector, we have disease notification officers in all our local government. They're combing the local government, looking for any case that could fit that description, so that they can escalate them and move them to the appropriate treatment center. In each local government, we've identified our treatment centers, which are health facilities where we pre-positioned IV fluids, medication, health workers, cholera kits, that we could quickly test people to ensure that diarrhea, ordinary diarrhea, or cholera. We've pre-positioned those since last week, since once we heard of the outbreak in Lagos. But what prompted this for us is we have been notified of two people. Yesterday alone, we had two cases reported to us, and we're investigating those. And because we want to avoid the spread, we're making sure that we want the public to be on high alert, and also our health workers, because some people in the private sector may not be conscious of what's happening in the public sector. So our private practitioners, as well as all our private public practitioners, we need to have a high vigilance and surveillance, so that if we see anything, a diarrhea that looks out of place, please call our disease notification officers.
Okay, I don't know whether what you are doing now is what we call advocacy, trying to sensitize people about this outbreak that has been reported in our neighboring state. How are you synergizing with market women, marketplaces, and other public utilities?
So this is what we call public awareness. We also have information and education posters that we put out. The posters, the physical posters. There are disease notification officers are out there enlightening market women, schools, actually bringing it to their attention what to look out for. So those are the things that we are doing, and as well as anywhere where a large number of people are gathered, we're out there trying to make sure that they do not sit on cases that could be reported and we could curtail very quickly. But the public has, even if it's out there, the public has a law. The first thing to prevent its spread is one, always practice hygienic, behavior. Hygienic behavior is washing your hands frequently. Because we touch a lot of things, and most of the diseases that affect us, we carry it in our hands and put it in our mouth. So washing our hands quite frequently, and most especially before we eat, after we eat, when we've been to use the toilet, we have to wash our hands. And when we treat sick people, we know our relatives could be sick, we must wash our hands. If we practice this, then we're less likely to spread the disease, even if it's in our vicinity. The second thing is water source. Because the reason it's worse during the rainy season is because there's a practice of open defecation, and when it rains, it washes this feces into our waters, into wells, and that can be consumed, and then that it could cause cholera. So we must, every single one of us, make sure we drink safe water. Boil your water, keep it in a safe place where it cannot be contaminated by feces or human excreta. And also be careful where you get your pure water from. Some of the pure waters are not treated water, so be very careful. And if you're not sure, boil your water. And for us that have boreholes, we must make sure that our borehole has treatment plants that will treat the water as it's coming out. Avoid wading in the river or using the river water to cook. Those are the things that we can do. And for those that have wells, there are treatment tablets that they can put in their wells. And they can get those if they contact the Ministry of Health, or our disease notification officers will tell them the source where they can get tablets to treat the well. It is important because this can be prevented. It's an easy thing. One tablet in your well, you'll be fine.
How can pregnant women and nursing mother take care of this?
By practicing the same thing, when you're pregnant, it doesn't, by washing your hands, making sure you don't use contaminated hands to prepare food for your babies is one of the things. As I've said, ensure your water is treated, and also maintain sanitation. When people want to defecate, they should think carefully that they shouldn't defecate where it could be washed into water source. They should use proper sanitation. There are pit lines, they should use them. Those things would eat it directly. Make sure that you take it home and wash it properly before you consume those fruits. And also, if anyone around you or yourself present with vomiting, diarrhea, please present quickly, or dehydration. Present quickly to any of our primary health centers, any of our general hospitals, and we will take over from there. And the treatment is usually free. The government takes care of the treatment if it's diagnosed as cholera. So don't worry about not being able to afford the treatment. We, the government, will take care of you as long as we can confirm it's cholera. So don't let funds hinder your engaging with the health system.
And this is not limited to even civil servants who are on NHIS.
It is not, it's the public, the entire citizen of Ogun State,
Yeah.
civil servant, uncivil.
Everybody is covered.
Yeah, formal, informal, every citizen of Ogun State, as long as you're diagnosed with cholera. and people to watch transporters because they travel between states,
Okay.
and traders, they go from Lagos or neighboring states and coming to Ogun State. So they have to be very, very careful how they eat. And when they buy their food, they should look around, look at the place, the source of water for which the person is using to make the food. So try and avoid, buying food that you're not sure of the source.
Okay. Especially when the environment is not hygienic enough.
Yes, it's an indication that the likelihood is the preparation might not be hygienic.
How prepared are you to take this campaign to primary and secondary schools? Because a lot of children eat whatever they see. They buy from here, they buy from there. They don't even care who prepares such food they eat. Sometimes they leak all these liquids. Who knows the content and how they are prepared? So how do you take the message to primary and secondary schools?
As I said, officers, disease notification or as disease notification and surveillance officers are out in the various local governments already doing this because we're aware that children are the most vulnerable. So we try and ensure that we create awareness. And the children can take the message home to their parents. They're good ambassadors for us. Once we create awareness among children, you're sure to know that the parents will hear about it because the children will get home and say, they told us not to drink water that's not boiled, we're to wash our fruits and all that and washing hands. So we focus on children, marketplaces, we're going to be out there. But please, the more important, we're using the public because we can't be everywhere. There's only 7,000 health workers, whereas there's 7.1 million Ogun State citizens. So we're engaging the Ogun State citizens to help us to help them, to please curtail this so that we don't have incidents where people are losing lives for something that is preventable.
Preventable. Okay, let's look at because we said they can go to any of the public hospitals in Ogun State owned by the government. God forbid, we don't pay for a high number of infected.
We have IV fluids, we have all the medications, we have the test kits for cholera, as I mentioned. And if we need help, we can send to NCDC, they will send us help. This is a national emergency, it's not just Ogun State. So the way we responded to COVID, there's always the national backing. If we get to the point that we feel that we might be overwhelmed, the NCDC will move in and support us. We already have our partners such as WHO, UNICEF. I got a message from UNICEF from Lagos saying that, do you need help this morning? And we said, no, we're on top of things. But if we need help, we'll let you know. So it's a multi-sectorial response because our environment colleagues also need to be involved with the disposal of waste, proper disposal, water, the Wole, they need to be out there also supporting the West. I think that's what they call them. Yeah.
The Ministry of Environment and your own ministry have been waging war against open defecation in the last couple of months. How are you going to intensify efforts on this open defecation?
We've been actually, there's a law. There's a law that says that every house, every residence must have a sanitary ware, a proper toilet, so that nobody needs to defecate. And His Excellency has been great people warning, and that was last year when we had a similar outbreak. But from now on, we're going to be punitive. If you don't have a proper toilet, we will lock down your accommodation until you build a toilet. What the law says is, if you don't have a toilet, convert one of your rooms and into a toilet. Or if you live in a compound, come together, put money together and build a toilet to make sure that, Ogun State is very advanced.
Yes.
We shouldn't be one of the states reporting high level of open defecation. And I think it's also because Ogun River passes through us, so people feel that it carries it away, but it doesn't. It just carries it from your neighbor, from you to your neighbor downstream, and then causes illness in them.
There is this superstitious belief in most part of Africa. They tell you it is one god or one goddess that is fighting. I don't know what you need to tell people about some of these things. When they see symptoms of cholera, where to run to and how to run to, rather than believing in superstitious belief.
So my belief is the Almighty God created all of us with wisdom and knowledge.
Yes.
And every knowledge, even the one that the doctor has, comes from God. So whatever superstition, first of all, meet the physician,
Yes.
and then we will deal with the superstitious side. But let us rule out that this is not a medical condition. First, engage the health system.
Yes.
Once we have done all that we know, and you still believe in spiritual, we'll send you to the pastors. But let us have first access.
You know why I ask this question, Honorable Commissioner, is that some people will tell you when you mix this herb with this herb and you cook it and you boil it or you drink it, this will stop. What's your message to those who believe in?
So those are the alternative medicine practitioners, and there is a place for that. But when there's an emergency,
Yes.
there's no time to lose, because we know that cholera has killed people within 24 hours. So we would advise our alternative medicine practitioners to refer anyone that comes with them with diarrhea. This is not the time for agbo and or asipo, whichever it is. It's a time to refer them to us, and to save lives, because at the end of the day, as a practitioner, be it alternative, be it orthodox, we're all trying to save lives, and any practice of yours should not lead to the demise of anyone. So please, once again, our alternative practitioners, refer them to us, and then once we diagnose that it's not cholera, then we can then discuss what else to do.
So people who believe so much in self-medication using ORT, oral rehabilitation, and what do you call it? Uh-huh. What's your message to those who do self-medication?
um, Ladies and gentlemen, this is not the time to do self medication. This treatment is free. I guess why people do self medication is because they don't want to be financially exposed. But we won't be charging. Present yourself and let us help you medicate yourself and nurse you back to wellness in the shortest possible time. Because you might be too weak to actually self medicate. By the time the diarrhea and the vomiting gets to you, that it could lead to fatality and unnecessary death. What we're trying to do here is avoid unnecessary debt.
Let's take a short break. We will soon be back. When you are healthy, and so Honorable Commissioner has told us, wash your hands regularly, maintain a clean environment, make sure the water you are consuming is clean and is portable. Clean in all sense of purity. Honorable Commissioner, this is rainy season and cholera seems to be coming up most times in rainy season. How can we combat it?
The major thing, as I've said before, is we should stop defecating openly. Use proper sanitary wear. Because cholera is transmitted, is fecal oral, as they say. It's from feces to mouth. So if someone is infected and they have diarrhea and they open their bowels in a proper toilet with a sock away and nobody has access to it, it's not going to get to the next person. The reason it gets to the next person, also mostly during the rainy season, is it gets washed into people's water. And also during rainy season, there could be flooding. and people are less hygienic when they have been displaced from their homes. They're trying to, make do with what they have, so they're not conscious about washing their hands. They're not conscious about where they get their food from. So that's why it's also heightened. Other states around us, they have it because of the overcrowding. Where it's crowded, hygiene is usually not as it's not at the optimal level, and that also predisposes to cholera. In Ogun State,
Yes.
when we've had outbreaks, it's been outbreaks in areas where people live in shanty towns,
Okay.
and it's overpopulated. There's no water, clean water source. There are no toilets, and places we've been to Lafemwa, some particular settlements where the method of living, is similar to that. We found yearly there's been outbreaks and refuse dumping in the open. Not there's Obama
Can
that
that
collects
one
our
too cause
refuse.
cholera?
Yes, it can, because people dump their feces in the refuse, and that can be washed back into the water source. So we've had to actually evacuate refuse from some communities to reduce their predisposition to cholera in the past. And we provided them with containers. There are containers all around Ogun State, particularly in the markets where Obama has placed their containers. Empty your refuse
Inside the container.
into the container.
Okay, Ogun State shares border with both local and international routes. Are you going to plant your people at the entrances, or you're going to place more surveillance in such areas?
We know where our weakness points are, vulnerable points. So our disease surveillance and notification officers are very active in those vulnerable areas, because over time we've collected data as to where our outbreaks and our weaknesses are. So once we have outbreaks like that, they are sent out. The disease surveillance and notification officers are sent out to heighten their screening and surveillance.
Okay, it's still OGBC 90.5 FM in Abeokuta, and the program is Awareness on Public Health with Honorable Commissioner for Health in Ogun State, Dr. Tomi Koka. She has told us quite a number of things, some of the steps already taken to combat the spread of cholera in our dear state. And she has said that everybody will be treated if you have symptoms of cholera in your body system by the government. She said either you are a former or informal civil or uncivil servant, just find yourself to any of the government hospitals if you have symptoms of diarrhea or stooling or excessive stooling, and that you will be treated. And she has said the disease to find out if there is any outbreak that will be combated immediately. She has equally told us that the international partners are equally on ground to assist in case the rate becomes alarming, which we all pray that it will not get to in the course of this outbreak. Well, I want to the the program is still awareness on public health. Honorable Commissioner, as we wrap up today, people believe information and you must spread the information from the. You need to have jingles. You need to place jingles, both English and Yoruba, that will go to the interiors, because radio goes further than any other form of information. So you need to put your jingles here and place it so that the people will hear more about this awareness campaign. But more importantly, Honorable Commissioner, is there any positive measure to whoever, that does not provide toilet in his or her house?
There is, as I said, it's I think you can be charged to court,
Okay.
and I think there's an imprisonment or a fine. But His Excellency has been magnanimous. But it's become almost imperative that we have to start enforcing it and using one or two people as scapegoats,
Okay.
to actually show that if you do not have a toilet and you have the capacity to do so, that you'll be penalized. Particularly landlords build houses and they don't put toilets. That's wrong.
So if it is established that there's such a person has a house and there is no toilet, that person stands to
It's
be
liable.
it's liable.
Yeah.
That litigation goes immediately against that person.
Absolutely, and it will be the Ministry of Environment that will be going after them. They already sent a warning last year, and they've just been lenient. But with this outbreak, you'll have to chase up on that.
Your final message to the whole state.
I'd like to inform all Ogun State citizens that unfortunately there is a cholera outbreak. We are vulnerable because it's in a neighboring state and it's the rainy season. What we can do to help ourselves is to ensure that we practice hygiene. We have hygienic practices, washing our hands regularly before eating, after defecation, and after every contact with an ill person. We need to ensure good water source for ourselves and our children and neighbors. If there's any incidents, there is a number that can be contacted
Okay.
should there be any outbreak, and that number is 0708. It's one of our infectious disease prevention and control pillar lead. That's Dr. Festus Adetonwa. So there is a name to it. And if not, you can call me directly. My number is on the state site and I can be contacted that way. Please keep your children and yourselves safe as we fight this together.
Thank you so much, Honorable Commissioner for Health, Dr. Tomi Coker. She's been our guest this afternoon on awareness on public health on OGBC 90.5. She's not alone in the studios. She's accompanied by Dr. Festus, Prevention and Control Pillar Lead for Ogun State. And then we'll see you some other time. Thanks for coming.
Thank you. Sorry.